Hello, everyone. While we're waiting for everyone else to join us, can we please request everyone to sign up and maybe drop your visiting cards in the box that's there up in the front. Thank you. How are you? Very nice. Are you a part of this? No. It will sunflower. Very excited.
So,
Okay. Hello, everyone. Hi. We're 5 minutes past 1:30, so we thought we'll start. Maybe people will trickle in slowly post lunch. So welcome to this session on decoding sanitation worker safety. I'm Mahima Vijendra. By the way, I have with me my colleagues Kavita Vankare, Santosh Raghavan, and Ava, who is from the World Bank. Today's session, this stuff post-lunch session, is going to be about how we address the safety of sanitation workers. And to that end, what does safety mean for sanitation workers? And to that end, we have implemented some initiatives, both at the global as well as especially in India, which are at various stages. And we will be discussing and taking you through some of these initiatives. And as we have implemented these initiatives, we've come across various challenges and barriers, which we would like to discuss with you and get your feedback and inputs on. As part of this session, we will be having two short presentations from the World Bank and from IHS, following which we will have a group discussion. We have a short activity where we would like to discuss these initiatives and the way forward for the initiatives that we present to you. And then close out with a reflection concluding session. Before we get to the presentations, I thought we should, normally do something to help us with our post-lunch sort of drowsiness. So we're going to jump to a short activity, which is a Menti poll. And I would request all of you to scan this code. And while you do that, we will try and bring up questions on the screen. Wait, were you able to? No, okay, I need to go back. Or give me a second.
Just go to menti.com.
Yeah,
And then the passport.
I can tell you the password. Yep. Yep. Getting some. Okay, we haven't got anyone from Europe and Latin America, but otherwise the spread. Okay, I'm going to move on to the next question. Okay, again, it shows the 5,000. We don't have anyone, but people working on the other side. That's nice. The next question. Okay, it looks like a lot of us in the room are from New Zealand. Yeah, no one from press. All right. And then we have one final question.
Just a quick reflection on this before I hand over to Ava. This is just showing what we all think and just wanted to get a sense of the room. And one of the things just to highlight here is that one of our aims of the session is to really go through the entire hierarchy of control for safety. It's not reflected here about how there are different initiatives beyond PP. PP is also important, and really kind of unpack what safety means. So that's one of the objectives. And with that, I hand over to Ava to make a presentation.
Good afternoon, everyone. So my name is Ava. I'm a water supply and sanitation specialist at the bank. I work primarily in the Africa region, but I also am a member of our global situation. And I'm here to talk to you about some of the tools and resources we're currently working on effective occupational health and safety along the sanitation search. So basically, sometimes when we discuss as a sector sanitation, we're mostly focused on issues of access. No, rarely do we talk about the people who would actually help us reach one of our objectives, which is safety managed sanitation. So a few years ago, with a group of partners, namely WaterAid, WHO, and ILO, we work on an initial assessment of the health, safety, and dignity of sanitation workers. And we developed a report that you see on the screen, where we looked at initially what are the challenges that sanitation workers face, what are some good practices when it comes to policy, regulation, legislation to improve the working conditions of sanitation workers. What are some of the gaps that still exist when it comes to improving their working conditions? And what are some areas of action? Then a few years later, we were joined by SNV, and with support also from the Gates Foundation, we are currently under the second phase of what we call the Initiative for Sanitation Workers. And these are the project activities that we're undertaking. And as the bank, we are leading or co-leading some of these initiatives. So looking at our own investments when it comes to sanitation, what can we do to improve the working conditions of sanitation workers? What can we do also to provide better guidelines, better procedures and regulations? We also undertook a review of technological innovation, and I'm going to go a little bit in details in all of that. And basically, all of these activities are grouped under three major themes. The first one is how do we make sure that we emphasize the political prioritization of this issue, no? Because in many countries in the word cloud, you could see some of those that this issue is not as well recognized. Also, how do we influence the WASH and the labor sector? And there are still many knowledge gaps that we don't have, that don't equip us to further talk about this issue. So how do we address those? So basically, we looked at these three activities that I'm going to focus on in my presentation. We looked at what is the main problem, which is occupational health and safety. By the nature of their work, sanitation workers are involved in, let's say, hazardous activity. And the word sanitation work in general is very broad. So we only focus on the workers that are in charge of operation and maintenance, cleaning of sewers, septic tanks, latrines, and main halls. In low and middle income countries, this work is heavily related to manual work in general, and it's highly informal. So it's really hard for this research to actually know exactly to find some of these knowledge gaps, just because of the nature of their work. It's highly and quantified and hidden based. So the workers, as I mentioned, are routinely exposed to many hazards, whether they're chemical, physical, microbial. They also work in confined spaces and dangerous spaces. So the work, also because of the nature that it's highly invisible, has very weak occupational health practices, enforcement, and oversight. So the first activity we undertook in each of these different activities, and that's why in the end, what we decided to do was to associate them as general guidance for the task teams in the bank, but also their government counterparts, is first to map out the different health hazards and risks that sanitation workers face, and organizing it in the different types of hazards, whether they're chemical, microbial, physical, or psychosocial. Then what are the different examples that we can find in the literature and in practice? And a lot of it is actually based on work that WHO did a few years ago on the types of risk associated with sanitation work. And what are the health risks also that we have? To give you an example, let's say a chemical hazard, the issue, some of the events that can happen is the worker inhaling methane or other toxic gases in a confined space, and there is a high risk of asphyxiation. Another way that also we try to map out these different health risk hazards and risk is along the sanitation service chain. And this is highly dependent on the activity that the worker would do, whether he works on emptying and transport or at a treatment plant or is an end user of fecal matter. There is a high chance that he may face some hazards and risk. I'll give you the example of, for instance, physical and ergonomic. So one thing that is also less talked about is the fact that a lot of workers complained about heat stress, the fact that the heavy manual work that they do, sometimes in very hot climate. I know we saw a lot of PPE being recommended, but sometimes this PPE is not adequate for the climate in which they're working. So it's very important when mapping out the hazards and thinking about some of the solutions for the workers to also put ourselves in their shoes. So as I mentioned, 3 of these activities, as you can see, is how do we provide better guidance for our task teams? We can have the best sanitation specialists in the game, but they have no clue how to deal with these issues. So how do we make sure that there's a better understanding of sanitation workers' health and safety, but also what is out there? Because in the end, we're not really reinventing the wheel. There are a lot of initiatives, and Kavita will mention it, that is happening. So how do we learn more about these things? So we piggyback on the World Bank Environmental and Social Framework, which replaced our environmental and social safeguards a few years ago, which comprise of 10 standards. And one of the standards, ESS2, is on labor and working conditions. So how do we make sure that through, let's say, this framework, we're better able to deal with this issue? Again, as I mentioned, we did a review of technology and equipment, and then also mapped the different good practices, policies, legislation, regulation, guidance, and other operations so that can help. So on the ESF and ESS2, labor and working conditions. So the ESF, let's say, is our vision of how do we do sustainable development in a context where the borrower needs to think about the different aspects that are related to environmental and social issues. And ESS2 in particular is looking at how do we make sure that the projects that we're financing, through them, workers are treated fairly and also are provided with safe and healthy working conditions. And these are some of the objectives of ESS2 in particular. And in each of these standards, the borrowers have to develop a list of instruments and documents. And one of the documents under ESS2 is the labor management procedures, which help to identify the key labor risk that a specific project would entail for the workers, and also what are some of the mitigation measures in accordance with the national law, but also ESS2 with some of the objectives. So basically, in collaboration with our social specialists, our team developed a guidance note that is specific on how do you prepare these labor management procedures when your project is dealing with sanitation workers. And again, sanitation work, let's say, is pretty broad, and in some countries they understand it differently. So we made sure that we defined it in this spectrum that I mentioned earlier about those who are in charge, let's say, of managing liquid waste from empty to end use. Another activity that we undertook that was pretty challenging, let's say, was a review of technology and equipment. Challenging, I mentioned, because one thing we didn't want to convey with this work is making it sound like technology and equipment is the solution, or is the silver bullet when it comes to resolving these issues with sanitation. So what we did was reviewing the technology about some of those hazards that I mentioned earlier. How well are they, let's say, protecting sanitation workers? What are some of the gaps that still exist in that technology? And some of the way forwards. For instance, some prior hazards that we looked at and how these technologies are resolving those was how well are they making sure that we don't have issues in the confined space, issues of asphyxiation or engulfment. Also, how well are they protecting sanitation workers with microbial hazards? And also physical hazards, the heavy manual work, the heat stress, the injuries. And also the fact that technology, we're hoping, can help address some of these, some of the challenges sanitation workers face, but there might still be some gaps. So gaps in the technology that avoid the need for the scientific, for the worker to enter the confined space for the itself. Also technologies that would reduce the frequency and the length of exposure to fecal waste. Also technology that reduces manual effort and control of physical hazards. Better safety wear, but that is also adequate for their climate and also where they work in general, but also that is easily accessible because you have issues of supply sometimes in some countries. And also welfare facilities, places where the worker can just go and rest, especially in the cases where the length of the activity is considerable, or they can shower and change, etc. So some way forward that review found was how do we bring imported but also locally developed technologies to the market? We have issues of scale in general. A lot of these technologies are still at pilot stage. How do we develop more homegrown innovation, both on research and development? And again, in the countries themselves, a lot of it is still in, let's say, developed countries and coming into the developing world. And also, how do we make sure that the safer systems for the workers in general? Then the third activity I mentioned was on the OHS tools. So what we did was identifying some of the instruments we wanted to look at, whether it's the laws or the policy, the regulation, the operational instruments, anything on monitoring and inspection and the standards that exist, mapping it across the service chain and also the different types of workers that exist. Unfortunately, this was based on, let's say, the network we have and the people we talk to, so it's not as exhaustive. Let's say the 3 examples that I mentioned so far are still also work in progress, so we still welcome feedback and looking forward to the discussion also later on. So Kavita mentioned it earlier, which is one thing I think all 3 activities found and recommended is that the first thing is really how do we control these exposures, not to the occupational hazards. And the, let's say, most effective ways are really how do we eliminate that hazard in the first place, or how do we substitute it? So mapping out or identifying these different hazards, like the table that I showed earlier on the different, let's say, chemical, microbial, physical hazard across the tasks that the sanitation workers do. Then how do we, for each of those tasks, identify some control measures, working on our way from, let's say, eliminating that hazard, substituting it. And one thing we found, and this is the discussion we have every time, is on PPE, which is actually the least effective of the controls. So looking forward to discussing a little bit more. Kavita also will mention it more. Before I leave, I want to leave you with this picture, which is from 1968 Memphis March for Sanitation Workers, just to tell you that we've come a long way, but we're still there. I think we're still there. And maybe last one is a quote from Dr. King on sanitation workers. He says, "One day our society will come to respect the sanitation worker if it is to survive. For the person who picks up our garbage in the final analysis is as significant as the physician. For if he doesn't do his job, diseases are rampant. All labor are dignity." Thank you.
Thanks, Mahima. Good afternoon, everybody. Thanks for being here. It's a much neglected topic. So at a very different scale now, moving from the global scale to really a few cities that we've been working in India, and really looking at the micro level and the challenges of implementation. Just to say, our broader work is on fecal sludge management, and which is the reason most of this work you'll find specific to desludging operators, and it's embedded in a larger FSM program. But to say that there are many kinds of sanitation workers, and I just want to pause at this slide because this is often still not recognized that there's so many of them. And what we found is that occupational safety, though we work with many of these workers, but occupational safety is something we figured out is impacted by roles, because if your nature of work changes, your hazards and your exposure changes, and also by the contractual arrangements. And this is a very important point because some of the work around sanitation worker safety has been very generic, and that's fine. But if you're really looking at implementation on the ground, it has come down to specifics. About the rest of the presentation is broadly in 2 parts. There was one part that was presented at the UNC conference last year, which was a research study at looking at the hierarchy of control of pyramid and seeing what measures can be developed. Subsequently, we have moved on and we've tried to implement some of these measures, and I'm going to present those. So that's kind of the agenda. So I'll start with the research study, very high level overview for those of you who may not have seen it. So just to say again, the context is where there is mechanical desludging, which is using trucks like this. And so the question is, why is the need for safety? And that's the thing, that even when you move from manual to mechanical, you'll still find safety issues because of many structural issues, which I'll kind of explain. And that's the context we worked in. It was a demand-based desludging. There was a robust informal market, and those are the kind of workers we worked in. So what the research study did was actually analyze the current practices and recognize what are the safety concerns, develop preliminary recommendations around them. And the study was done using multiple methods and a systems thinking approach. This is just to say, again, from the study, I know you can't read the map on the right. The point of putting that process here and there's a blow up there, just to say that the whole desludging process, which looks like a simple process, was divided into almost 50 plus steps. Each step was analyzed for what are the safety concerns there, and hence what are the critical decisions that one needs to change. And we often think of desludging as something that happens at the site of the containment system, but actually it starts from when the worker starts to when he disposes it off, etc. And so we had to look at the whole thing. Just to clarify, when we worked with the workers, there was demand to make entry into septic tanks or confined space safer, but it's illegal in India and it's not the way to go. So we have actually worked towards how can you eliminate the entry altogether rather than trying to make entry into septic tanks in the first place, which should not be happening. These are some of the issues that came up. One was inhalation of harmful gases or lack of oxygen. I think Awa mentioned some of these, contact with sludge and physical injury. But more interestingly, it was to see why these things were happening. And there were some underlying reasons. A lot of them were to do with how containment systems themselves are. In India, many other countries that I have talked to colleagues from, these septic tanks or any other pit latrines are not built to standards. They are not accessible. You often have to break them. They're not cleaned properly, leading to solidification. And there is the household behavior of dropping things in the toilets, which are not supposed to go there. There's also a issue of decanting station as a specific thing of site of disposal, but could be FSTPs, fecal sludge treatment plants also. And finally, the tools are not appropriate. Here, I'm not talking about protective equipment, but the tools that are required to do the job are often not there. And finally, we found that there wasn't enough awareness among sanitation workers, but also among households about what they had to do in order to address some of these underlying issues. So on base of that paper, same slide, and it's a good, there's agreement on these things. We used the same framework of hierarchy of control and said, what are the different recommendations that we can come up with? Now, I'm going to take a moment on this slide. These are all the activities that we came up with that we thought would improve the safety of workers. The ones in bold are the ones I'm going to take you through, so I will not speak on them. But just want to say that some of the things we dropped, not because they were not important, but we felt what is feasible. And I think just to highlight here that we are working here in a resource scarce environment. So even though we wish there were resources to scale up everything, they aren't. So we picked some things we thought could scale up. So for example, something like vehicle design, we dropped because it was an overhaul of an entire manufacturing industry, which is not feasible in the short run. We also recognize that changing the behavior of households, whether it's not getting them to put sharp things in toilets, is important. But again, we felt that that would stretch us thin very much, so we dropped it. So just to say that it's very real on how we went back. And on the initiatives that I'm going to present, just to say there are some initiatives we've demonstrated and they're being scaled up through government systems or some other mechanisms. However, some of these initiatives, we've hit a roadblock. So one of the reasons of coming and presenting here is to also share those challenges and as a sector, see what we can come up with, or if you're thinking of something very wrong and we could be doing better. So that's where we are at. So let's start with the first one. The first one is to do with the retrofit of containment systems. The requirements there, which are there should be a vent pipe or a top slab, is a requirement from a worker safety perspective. I recognize that containment systems have other requirements, and what our team has been doing back home is come up with affordable designs which can be retrofitted. So we were looking at existing containment systems and seeing how to retrofit, which meet both the standards and the worker safety thing. I'm not going to go into details of the design, happy to talk later. And we've demonstrated it and they work very well. We've monitored them for a year now, but the question comes of who will the household retrofit their systems? We're not talking about the urban poor here. One can make a case, they can't afford it. But even with the middle class, there is no incentive and the poor regulation. So how do we move forward? So it's an open question. I hope we get some answers, but that's where we are with this. Second one was around tools and equipment, and that was actually broken into a couple of parts. So if you see, one of the first requirement from a safety perspective is the gases should be removed because a lot of workers were inhaling the gases and falling in. And we actually, there the problem was something else. We found H2S monitors, we found sensors in the market, but A, they were too expensive, and B, even if you made them available, could not be used by sanitation worker without a lot of training. So here again, I'm sure it's available in other industries or maybe available, but we could not find a technology that's appropriate for the workers. The story on the blockage removal tools, because that was the other thing, like I said, one of the primary reasons for workers getting inside septic tank was because there were blockages, which their vehicles were not able to remove. So, excuse me. So the rest of the slide is about that. There we found tools. We did extensive field testing with workers, and these are just 2-3 tools we found, but we found that they eliminated the need to enter the septic tank. They operated by hand, do not require electricity, and they require only minor modification. What happened in this case was they are pretty expensive for workers. It doesn't help them. And they do not see value in it because blockage removal is not that it happens every time. And I have some costs in the end, so that'll give you a sense. We tried, okay, can we make a business out of it, right? So we said if there are 60 or 70 workers in the city with trucks, can 2-3 people provide the specialized service? That didn't work because of the nature of business, because they typically go there, discover there's a blockage. By the time they have to call another person, nobody's going to wait, right? So again, here, if there are suggestions of how we can think of more innovative business models, it's a good idea. But for the same reasons, we've done all the background work, at least for the blockage removal, but we are at a stage, again, due to costs, how to scale this up. I just want to say this is the same thing for PPE. PPE, the issue is, there is an issue of right design, there is an issue of access, but how do you maintain PPE? Again, it's the same question of costs. What we could do, there were some other very simple things like a torch to check the sludge, or maybe caution tape. The very simple tools cost less than $50, which would add to the safety. These are things we are now working with workers in a few cities to get them to buy this and increase the safety and the openness around this. So this was around tools and equipment. Moving on to the decanting station. I'm going to speak about decanting station, but we've done a similar thing for our fecal sludge treatment plants. And essentially, when the disposal is happening, there is a lot of risk of contact with the sludge. So we've done small changes, small design changes to increase spillage management, etc. So that's been happening in the decanting station as well as FSTPs. We also find the workers didn't have place for to wash hand, and we talked about importance of hygiene in the plenary, or just have a bath before they go home. And we are hoping that many of the disposal site facilities become the places where they can actually do this, rest, etc. The thing is, while the operators are private and the informal sector, these are government facilities. So one is doing advocacy with the government to kind of implement this in all their states, because it's a very additional cost, and we are in the process of scaling this up. Moving on to protocols. So we've developed a protocol, and that protocol covers everything from use of PPE to equipment to a first aid procedure, and that's something I'm going to speak about. But the thing is, again, what is the point of providing the training if you're not going to be able to purchase those equipment or PPE? And that's why we see many trainings for sanitation workers, and they're happening in bulk. But the question is, what's the point? So what we've done is now broken down the tools, the training into phases. We've done the first aid. So we're training them on that. There are some simple tools they've been able to buy. We're training them on that. So we are sequencing our training with what is available. We've done a fair amount of research on how we should communicate. And there is, in India, I'm sure in many other countries, there is either illiteracy or frankly, they don't enjoy reading. So we've been trying to work with some games and tasks and activities for them to do. This is again work in progress, but you can see some of the visuals we're developing. But it's very, very clear that this is very important. Otherwise, they're not going to get the message. We're also trying to see whether through some daily reminders, some comics, they can be reminded on their own instead of just one-off training that they come to. Lastly, this is a first aid training manual we've developed. There are copies here. I'm sorry, they can't be taken away. We only have a few, but please have a look. This we did because we found that actually, while all these other initiatives were being rolled out, you could, for a very less amount of money, purchase a decent emergency kit, and we've got the details of that, and actually have it sit in their trucks, right? And we've designed something that goes into the truck. And now this is a training of trainers. We just released this last month. We are going to be now scaling up this training either through government departments or other donors, I'm hopefully, who will be amenable to this, because this is something is for us a quick win, even if this is not the most important thing. But again, just to highlight here, these things require detail. Many of the people have approached us and said, can you use this training manual for other workers? And our answer is no, because the risks are really different for different kind of workers. Lastly, this is PPE. We've done a fair amount of research like tools, but again, I would say the recurring PPE costs are something we are finding it an issue. If they do not want to buy PPE, again, they're using the same set of gloves, etc., for a long time, which is making the use actually redundant. This is just a summary of cost. And just to say, if you look at the PPE costs, they're really high, because those are the costs that come up if you change your gloves at the right time, etc. Your blockage removal tools are very expensive. So those are questions we've not answered. Some other things are less cost, and we are kind of working with that. So just to conclude, to say that there are issues of affordability, so which workers don't want to pay, or they do not perceive value. But the question is, who will then pay? And the situation in India, many other countries, is post-COVID, post other priorities. Do ULBs actually have the wherewithal to pay for this? If not, what do we do? And this really ties down to the question of, is public sanitation a public or a private good, right? Because even if it's a public good, even if these workers are private or informal, the cost should be borne by the public sector. And here's the conundrum, I don't have an answer. This is also to do with the informal nature of the sector. If probably the players were bigger, you may see better safety. We don't know, but that's what we are assuming. So it's tied again back to that. And lastly, to say that this is working with existing containment system. How do you retrofit it? Existing trucks, what can we do? We could tomorrow have a technology or a system which would eliminate the need for all of this. So we can hope for that, but otherwise our work has been trying to find incremental solutions given resource scarce environment. So that's where we are. And yeah, we can open up for questions both to Awa and me before we go out into breakout groups.
Yeah, my first question to the first presenter. What I will ask is, what's the World Bank's approach to influence or maybe, yes, I would say influencing occupational health and safety laws, or not just standards, but laws, regulations in states that do not, or countries that do not have occupational health and safety laws at all, let alone say guidelines or standards. So that would be my first question. And then probably the follow-up to that is, because the environment and something standard that was shared, it was like purposely for a project. Maybe when a project is being implemented. What about beyond the project phase? What happens? What works? So that is.
So we had a hand up there, so probably just collect a few. You had a question, right? Yeah.
Hi, my name is Beth, and I work with soil and weeding on a container-based sanitation model, and I was curious if that was included within the World Bank assessment as one of the sanitation technologies and the types of sanitation workers studied, and also in your work and research.
Thank you for the question. So on the first question on the influence, let's say, to countries' laws and standards, that's exactly why we're doing the third activity that I was talking about the mapping of the different legislations and regulations. in order to better, let's say, advise our client countries, on these different regulation or law that exists somewhere else that could be adopted and adapted in their context. So we have in the practice an initiative that we call PIR, Policies, Institutions, and Regulations, where more and more we would like to advise our clients to think beyond just infrastructure, but also the enabling environment. It has existed in many different names before, but this is, let's say, the branding that now we have. And on the ESF in particular, yes, it's looking at projects, but if you saw in my presentation, I talked about the country laws and also ESS2. This change from safeguards, let's say, to the standards is really how do we think about it beyond projects, How do we influence labor laws in countries so that they look beyond the project? And let's say, challenge that we actually had with this particular, with working on this particular guidance node is the fact that sometimes the projects are just looking at the capital expenditures, right? Like just investing in the infrastructure. But a lot of issues that sanitation workers face happen during operational maintenance. And discussing with our colleagues who work in the ESF, let's say, department, they mentioned that that was actually the reason why we moved from the safeguards to the standards. It's how do we look beyond just investing in projects and sustaining, You saw what I said, that it's our vision for sustainable development. So how do we look beyond projects because they're not as sustainable? And that's why we could, let's say, influence that particular standard, because now it's looking just beyond investing in the infrastructure, but how the infrastructure will actually be operated and maintained. And on Jess's question on, let's say, container-based sanitation. So we looked at, yes, the different, like to say, the service chain model, the different initiative that exists, and container-based, let's say, in general, not soil in particular, because as I mentioned earlier, what we tried to avoid was, let's say, saying you should go with this particular technology, but looking at what the technology itself is doing to control some of the hazards. So we looked at container-based sanitation.
Yeah, no, we've not worked on container-based system, but happy to chat if there's some learnings that can be transferred. There's one more question. Yeah. Yeah, go ahead.
My name is Eva. I was just wondering when you were doing the whole process, whether you looked at the local equipment that they're using and how they can be modified for ownership, because most of the equipment are brought for them to test. And usually they have what they've been working with for the last 10 years, and how can that be put on board? And the other point I would want to also know is within their spaces, is there any incentive, like when you want to come here and do a presentation and call it for paper? So what is there for them to be able to like compete amongst each other, for them to be able to be put on? Where did you look around that so that they can be comparatively from Asia to Africa?
She's asking. The question was directed to both. Okay.
It's Tanvir from Bangladesh. So I'm going back to partly to his question about this ESS2 and labor law, as because you know that different countries have labor laws, and the ESS2 kind of builds on that and kind of supplements that, and it's you rightly said that it's for the greater good and to promote sustainability. But the problem here with the sanitation and wastewater is that they are operating very, very informally, and there is no governing body, governance, or any other thing. So you will find, like in many factory environments, there are far more difficult conditions than what even they are facing, very adverse situations. But we don't talk about that because that has a certain governance system, and the factory owners are supposed to, or they are bound to provide PPEs bound by the labor law. But here, since they are operating in an informal sector, the law, ESS2 or any other thing, they are operating beyond that. So you have to, I think one thing we cannot ignore is that you have to formalize their role first. Bring them under a body or an institution, then you can apply all sorts of laws or ESS2 on them. Because as long as they are informal, you won't be able to kind of, I mean, that's my point of view. You won't be able to know law, or no matter how stringent it is, there is no enforcing for it. So I think that part has to be addressed in no matter how difficult it is, that the role has to be formalized, put under a body or a local government institution or whichever institution it is. Then you can hold that institution accountable. So institutionalizing their role, formalizing their role, that should be a priority here. Then all other things might fall into place.
So I'll start with Eva's questions on when we were doing our review, we looked at that. So what are they currently using? Not just the technology that we, let's say, hear about, but what are sanitation workers using that also works for them, but maybe they need some tweak, Hence the second part of our work, which is what are the gaps that currently exist that can, let's say, be filled to deal with that. Like one example, for instance, is on PPE and how, let's say in Madagascar, some of the workers were using material that is locally available to make their own PPE, but that also helped with the heat stress that they may face. So looking more into that aspect, it's something we were also looking at. And on your second question is something we really struggle with, which is sometimes we tend to just talk among each other and we don't really invite the workers themselves to speak for themselves. So on that list of initiatives that I mentioned, one of them is the ILO conventions, where ILO is trying more and more to get the workers. And some of the, let's say, limiting factors we have is language, like how do we make sure that whatever we produce is not just, I think I mentioned about reading, is something that can be easily accessed for the workers. And also when you invite them to speak, also we offer them opportunities for that translation, etc. That's something we're working on the wider, let's say, working group. And on the, let's say, ESS2, ESF, I think I made the caveat that this is within, let's say, World Bank projects. And we're aware that there are many aspects. And when it comes to formalization, it's a long debate we had even within the organization when we're doing the first phase of the assessment about the do no harm, which is, yes, let's formalize, but if you force too much formalization, you might also take them even further into informality. And I think India faced that challenge at some point. So how do we make sure that it's a phased approach, but also it's not just the responsibility of one agency or only us speaking at the global level, but how do we make sure that we're all working together at these different levels? Because sometimes you may have these national laws, but then they may not translate into state laws or into local laws. And so it's like a lot of things happening at the same time. How do we make sure that we're not just speaking at the project level, but working with other organizations that may be better fit to resolve those issues? And that's why our working group is still growing, but we count a lot on ILO, for instance, to help us with some of those aspects. And how do we deal with things that are under, let's say, our sphere of influence, I would say.
Yeah, just to quickly respond. So the tools that we worked with are locally manufactured. So we weren't looking at tools that were being imported, and even at the PP. And what we also did in some cases, this was more in case of PP, we looked at tools that may not have been manufactured, particularly for sanitation work, but they were available, and how could we modify? Because we realized that's the only way it's going to scale, right? So we're very much aware of that. On the second question, which is very interesting, a few responses. One is when it was extremely difficult for us in the first phase of the study to gain the trust of the workers because they themselves there were many things like, people carelessly took their photograph, it came in some media. So it took us a long time because we did extensive video shooting of theirs. And so we had to anonymize a lot of our work. So very aware of that, but also what we acknowledge in the first paper, and we actually begin that paper by saying that we built a lot on the tacit knowledge of the workers. It's not that they don't know that safety is not important. So they do know, and we built upon that knowledge. And what is it in them? I think one is their own safety. And here we found that, in certain cities, certain older workers, they're more aware. And so we're trying to get them to act as peer leaders to talk about safety, because what's in them is actually their own safety. But also, just to conclude, very different initiative, and you'll find a postcard and a badge there. It is very important for them to speak, right? And so one of the things we've done is actually start a series of panels, this not on safety particularly, but called We Speak To, and we actually get sanitation workers of different kind on a podium like this and get them to speak to into a, what do you say, open, like public. We've done 2 events so far. It's not everything, but we recognize that they have to articulate their problems and the solution, the problem, but it is a very live issue. So thanks for bringing that up.
So maybe one more question, yeah, go ahead.
I'm just wondering, thank you so much, actually, both of you for the presentation. It was really wonderful. Just wondering about your point with can we leapfrog? What opportunities do you see, for example, where on-site sanitation uptake is actually quite low as a percentage? How do you feel like these findings would feed into design of getting the trains that are easier, safer to empty, for example?
So we've been working. Santosh, do you want to take this question? Sorry, I'm putting my colleague. No? Okay. So that's my colleague who actually has been working on the ground on the containment system. We, apart from looking at improvement of septic tanks, we've been trying to pilot certain technologies, some of them with the Gates Foundation, some other local technologies. And there we are actually trying to see that it's a leapfrogging and not the thing. What we are very mindful, and we've begun these conversations with tech companies also, that when you are designing the system, please keep the worker safety right up front. We shouldn't be leapfrogging into another system which is environmentally safe and good for public health and doesn't take care. So those are conversations, but I think those need to be strengthened for sure, because there are lots of technologies that are there being tested, and that needs to be brought in center. So yeah, Brookbuck, sounds over there.
Right, so we have organized some group work for the next part of this session. And before we divide ourselves into groups, I will just quickly take you through what we planned through this part of the session. We would like all of you to spend maybe the next 15-20 minutes the most to discuss this question. So what are the different initiatives that can be implemented to improve safety of sanitation workers, and who will be responsible for this? Who will do these or implement these initiatives? Yes, sorry.
And what about why? Why will they do it?
Yes, okay, we will add that to the question as well, absolutely. So in discussing this question, we have put down a few points that we would like you to consider, which I'll come to a little bit later. But we were thinking that this can be discussed bearing in mind maybe 2 profiles of sanitation workers. And the first option is to discuss a generic profile of a sanitation worker anywhere in the world. And the second option is to discuss a very specific profile. And these are some of the points that we would like you to consider when you're discussing this particular sanitation worker profile. So to divide up the room, I would like you all to think about which profile you would like to consider. And I'm going to ask you a question now as to whether you would like to discuss that question in the context of a generic sanitation worker, And if that's the case, can you please raise your hands so that I can see if you'll be interested to do that? Yes, the first one, which would be just anybody in the world.
So the others would like to work on a desludging operator. We're just giving the choice so that it's easier.
Yes, a desludging operator, specific desludging operator profile.
Probably make this enough, we can have in mind a very clear picture of what we're targeting.
Okay, so these would be the pointers for that very specific profile. So those of us who want to work on a generic sanitation worker profile, maybe we can, I think there was about 4 or 5 of us here, so you can all form a group, and I would request people to move around a little bit. And the rest of us can also form groups of maybe 5 or 6. I think we're about 18 of us in the room, so 3 groups. One of those who just raised their hand of the generic sanitation of the profile, and the others maybe 2 more groups.
Yeah.
Okay. Go back to yeah, here, I don't know, they're on the side, I think. No, I think.
Are you all?
Candidate that speaks through, please divide.
Yeah.
Any other general?
With a specific profile on this side, so that you know.
Are you all?
If that's something that you are interested, yeah. Okay.
You all go. I think I was only get 2. Yeah. Which one are you?
Which one are you working
I don't want to.
This one.
Yeah, I'm gonna make it. Look at that. We got another.
Recommendations from your side. Please to prioritize.
Profile is there.
In the one, or we choose
Yeah.
one?
Yep.
There's only one.
All the different characteristics of the.
Oh, yeah. Mahmoud, could you just, okay. Taking it.
Yep, let's move to this. So this, they're the only ones.
Can you also take a photo of this if you're working on, because we just moving to the 3rd slide. Sorry about that. Yeah.
They're the only ones.
Yeah. Please consider these points. They are not binding on you, but across various levels, and how can we move from policy on the ground, and how can we think about scaling? We won't give anyone.
Okay. This sheet has been given to us.
Yes, I finished it. Did you? Yes. Sorry, before you jump right in, one more. So I think we were, but at the end of the work, there are 3 key messages that come out of the hand out. Details, one is around and you take back. So that would be part of the report on that.
And let me
Yeah, thank you.
Already, I'm just trying to.
All you do it for.
No, I'm happy to. Get it something.
So we. About specific desludging work. See, they work in small teams of 2 to 5. They work in house. Part of what we don't and the other is up to a person. They're not on the private. And they need threads and law enforcement. Income is dependent on daily demand and rate. Supplemental income is storing the blockage. Dead, that's our one, so we're imagining one first, so it's like one.
Right. Didn't help me, so that I'm gonna, who's giving this an explanation. In the private sector, higher up. So I was wondering if there was some connection between how that market themselves and an opportunity to pay for. It seems to me that keeping the kind of colleagues is. But if you were marketing yourself as a company that took care of, I'm sorry, the hygiene of the environment. Household. I don't know, the clean to see how we can start the battle with the
Right.
That's remarks things into I don't know.
Well, I was keeping leave the guy for wait now. Who comes? The question is, some sort of intervention. So ensure or such one of the insurance for that is a kind of where what are we driving and ensure it's on your no education professionally not all that professional. There is a so to have a move. The local authority, what can they do so? And then not laws. Yeah,
I think it depends on the context. Yes, you can, for example, we have like worker information center or something. That's the biggest thing, I think. If you're in government, it's against by the employers and the community. Probably I have like you're going to get some harassment or you're going to get really low return. It's not like they're going to pay you very well for the service. when I hear that someone's job is voluntary, I'm kind of fearful there might be indented labor, for example. So I actually think that having financing, having like legal protections. Safety, and really having, they have some visibility, some kind of safety net. Yeah, it's hard to otherwise see and demand on profit or having in place some safety. Because then looking point for responsibility and like that, right? And maybe and then something. That's right. And like you're about the same thing in the air. And I'm not. It's a very lot of that other. With that. With a checklist, so we have the come up with like drama or sketch to show how they was. What's the have to do with information that posing or moving to so the preference is very important. So it's not important to do with that one. So the national medicines decisions the allegiance and they send the information show them they felt like governments want to show out show them out
Yeah. We are going towards some added benefit for an informal worker who is operating outside the company side. The benefit to come into and part of being inside the corporate. Either better bargaining for the PPs and things like that.
Yeah, so the benefits should be
The cooperative.
So we have a private.
But then you have to set a policy like that. So if you are part of the cooperative, then you get the policy. If the decision. The idea is for them to form a private entity, whether they become a business inside. The corporate is limited. So when people look for this project, go to the cooperative, you need jobs. But then how would I know that the health protection in, I mean, By one learning, I go to that person, but if that, I mean, the point I'm getting is like.
They have non-direct.
They have a what?
Yeah.
A certification.
Do people, like customers, do they want the? Sorry to interrupt, but just, this is a 5-minute warning. Warning.
Luxury, we have like a safety, and we have incentives.
The certification seems important because then you can, then householders may want to purchase that service, right? And that.
And also same levels when the charge of what they are supposed to do. They can't get
We've done it, we have to go away.
Yeah.
To the household, or that if it's that guy, everything will be clean that time.
Front there. There's no way. There's nothing wrong. No, it's way too easy to report.
We have something like that in Bangladesh, Dhaka. Okay, that's the hygiene community technology. Brand value.
Yeah. But then.
But in this process, there is some money involved because you need to get that money. So the NGO acts as a supervisor. Help them negotiate that.
The motivation.
The government can give money to the NGOs. Now the government has to have the money. Take this money.
So that could be more of a role with like different. Someone has to provide. You could have like 2 or 3 actors, maybe I can get another government. I can see multiple ways to figure out.
It's true for any informal. Not only sanitation.
Yeah, there's some.
But then there has to be continuous monitoring.
Yeah.
That people are being what we want in a way how we want it to be. Has to be something. If you're standard cars and
That's an easy one. Like it's unworried.
Oh, yeah. So what are the different work initiatives? Building confidence?
Yeah, that has to be.
Okay, everyone, can we? Hi, can I have everyone's attention, please? Hello? Hi. Yes. Yes, we do, and we have only 10 more minutes left. Yeah, can we please get to the report out? Yeah. Can we please have the three rapporteurs come up to the front? Everyone. Yes, can we please have everyone's attention? Yes, thank you. Can we have the three rapporteurs come to the front? Thank you. That's an initiative.
Okay, so. With the start.
Presidential.
Okay, so we'll discuss the a sanitation worker who is vulnerable and just a little for livelihood, and yet have no PPEs to protect himself and then his family. So what can we do to improve the health and safety of this worker? We're looking at having some legal policies and protections for them. So even though they are informal workers, they work within a zone in a city. So if you have local governance systems there, when we are planning, we need to include these people in the safety net protections. And then we also discuss experience from Ghana, where informal workers, you put them in a cooperative. Because it's difficult, even if you put the protection, governments cannot deal with them individually as workers when they are just one or two going around homes, dislodging or cleaning homes or picking even pickers large from biodigesters and all that. So if you're able to put them in cooperatives, then whatever protection that government is putting up or whatever help is coming from whether a private sector or a philanthropist or NGO, you have the target population to deal with them as informal workers, and then they all benefit equally. And then they also feel that when government is interfering too much with their activities, it's more like a threat. Your government always come to private people to collect money, collect taxes and all that. So we have intermediate person. So there's an organization in Ghana we call UEGO. They fight for waste pickers, especially women. So they lead the bargaining agreement between government for them. They trust NGOs more than governments. So whatever that they want to tell government, they pass it through the NGO, then the NGO will tell government and they get that trusted support. And then we also, our other points was capacity building. especially when it comes to the tools that they use, the PPEs. You use the leaders among themselves to lead this development, these trainings, engagements. You use the people, the waste workers in the corporate, you choose the leaders from themselves, and then they also need to do continuous monitoring. You should use them, the informal workers, the leaders among them, to do the monitoring and then report. So you don't bring a whole lot of outside materials to kind of institutionalizing them or formalizing them, but rather use the tools or the language, the culture that they operate, that they are accepted, to support them to protect their health. Thank you.
All right, so our group had the more general sanitation worker. We had a bit of a freewheeling discussion, which I'm going to try to structure into 3 points, but my team can all jump in if you want. We talked big picture about the need for regulation, and that without some sort of framework around what's allowable, you won't really be able to make any progress. We did get into a bunch of discussions around how you enforce that without penalizing the wrong actors, whether you could instead create positive financial incentives, things like insurance schemes that would only be applicable to groups that were following the regulation. So that was one kind of big picture initiative we talked about. We also talked about PPE and the issues with the availability and the motivation for making that available. Talked about the potential need for that to be subsidized, or perhaps reducing import taxes so that businesses, NGOs, et cetera, can actually afford it. And a little bit about the motivations for businesses like Soil to make things like PPE available around worker retention, and how they need to see the positive benefit of that as well as just the cost. We talked a little bit also about behavior change and the difficulty of getting sanitation workers to adopt practices. And we had a bit of a discussion around what might motivate safety practices, and that it may not be just a health motivator. It may be because it's a more convenient practice, it's faster, it's you can get more desludging done in a day, it's more comfortable, or just less kind of smelly and all of that. So yeah, we talked about those couple issues along with lots of other topics. Anyone, did I miss anything?
Group number 1. So it's very interactive, interesting, interesting participants. Yeah. So we looked at just go direct into it. So there are those who are in and those who've not been there. So yes. So number 1, inclusivity, whereby we are looking at inclusivity, the need of ownership of the sanitation worker, that from the very beginning of a conversation, even when you're talking about policy, it is the policy that is informed by them. So from the very beginning and planning, designing, that they should be there. And especially taking the advantage of the sustainable development goal, leaving no one behind. So who are we leaving behind? So that is why inclusivity is important. Partnership at different categories, at different levels, from health, where we have local health partnership. They need that already gives them a recognition with the public health, where they need the tetanus injections every 6 months, and you come up with proper partnership from the ministries of health that already now gives government recognition. They do exist. And also partnership when it comes to the workers, ILO, International Labour Organization. When they're discussing about partnership, the laws that are there, the policies that are there were not designed with them in mind. So completely, if you look at the guidelines, if those are the ones we are going to follow, then they will really get lost. So partnership in this, where we create a white table where everybody comes in without judging any other, or without looking down on another person. Innovation, ownership. Innovation and ownership. When I talk about innovation and ownership, is already we have there's what they've been using for 10 years. How can we build on that? They already have ideas. The only thing they do not have is an engineer on the table. So if you bring their ideas and the engineer on the table, then totally we are going to have a very interesting equipment. And they already have these ideas. If you ask them, they'll tell you this equipment should have had a shredder, because what we are using is a lot of pampers and pads. That is what we are scooping out, not really the sludge, but it's contaminated. It's come into contact with the sludge. So political recognition, this is very important. If you come from, okay, I'm talking about Africa, I come from Africa, where all the politicians go to them looking for votes. So it is at this point that they come together, have organized CBOs, and they give a demand. We are going to vote you, but if we vote you, you're going to recognize us. And that political goodwill is going to take the policy conversations and the guideline conversations on board. So if we get that political recognition, we're already doing it in Kenya. Those who are from Kenya, they know that we've taken the manual emptiers to the minister's office, and that recognition just brought great changes. And then peer-to-peer exchange, where I asked what are the incentives that are there. I'll be so excited, I think, very soon to see a conference about manual emptiers, where they are competing, discussing, and all panels are just themselves. So if we get those peer-to-peer exchange on innovations, peer-to-peer exchange where we have competitions, and we can be able to take some from Africa to go to Asia and see, and that will incite all the others, or will encourage all the others to compete. Thank you very much.
Thank you, everyone, for very actively participating in this group discussion session. We've run out of time, but we're going to take a few more minutes just to close the session out, and then maybe also ask for your feedback.
So just quickly, and we wanted to wrap up with you all to tell us basically if you have any feedback on what we've presented, Kavita and I, also any aspects of safety that was not discussed, whether in the presentation or the group discussions, and also what are the next steps and how can we continue to engage with this group basically. So you can just raise your hand basically and talk. We didn't have really closing remarks or anything. Yes, go ahead.
Or not just maybe something for World Bank to reflect on or to think about. Will it be possible to refuse maybe funding particular projects if it realizes that countries do not have maybe specific health and safety laws that could protect workers across especially sanitation subsector? I think that would be a big question World Bank will have to probably look at. For instance, in Ghana, we don't have comprehensive law on health and safety. It just probably health has something, mining has something, of factory and offices, shops, and that's 1974. So there's something on us. Yeah.
Thank you.
I think just in terms of next steps and how to continue engaging, one request, I guess, is so Eva and Dennis are both active in organizing focus groups with manual emptiers, maybe just tapping into some of the work that's happening directly with manual emptier or emptiers in general, sanitation workers. And I'll just plug Dennis's poster presentation tomorrow, which is presenting that work. But I think, yeah, so curious how we could engage kind of connecting those key messages that are coming through our colleagues.
I think it's high time we ensure that people who are handling sanitation waste are safeguarded. And the way to do it is to take responsibility as leaders in sanitation to ensure that these people don't operate in an environment that is not legislated. And to do this, we can ensure that we get these people from companies, because this is an enterprise. They collect money from the business they do. So it would be very good to advocate the idea of having registered companies that are recognized by law. Then when we get these companies registered, the next thing that will follow is we will have people who are responsible, who can be engaged on the health and safety of these people based on the law in the country where these particular guys are practicing it. So through that is that's one of the best ways to institutionalize this idea and ensure that everybody working is safeguarded and they are operating within a health and safety law that will be able to take care of their health and safety.
Thank you. Great. Yeah, we're 5 minutes over. Thank you so much for those comments, that feedback. We have up here a QR code, which if you scan will take you to a Google form where you can provide more feedback if you like.
Currently set that you need permission, so.
Okay, we need to set that right. Okay. We will do that. Yes, so that brings us to the end of the session. Thank you so much for attending today's session. And I'd like to request everyone, please drop your, visiting card, business cards in that box up there. We also have some material up in the front here, which you could take with you. And yeah, we hope to see you at maybe our next session, which is on Friday in the morning. Thank you so much.
Yeah, here, I'll show you. Yeah. Thank you. I know.
No, I know.
Like, yeah, that's good. That I figured like I'll refresh it. And go, yeah. Nice to meet you. Yeah. I feel like on
Yeah.